Hello, my name is Laura Katarzinski, a Benedictine University graduate student. Follow along today to dive into the topic of arthritis, musculoskeletal, and skin diseases with an emphasis in fibromyalgia and alternative therapies to help alleviate some symptoms. Arthritis and musculoskeletal and skin disease, AMS, encompass a diverse group of conditions affecting the joints, muscles, bones, and skin. In the United States, these disorders collectively represent a significant public health challenge currently. The prevalence of AMS conditions varies across age groups, with arthritis being more common in older adults, while certain musculoskeletal and skin diseases may manifest at any age. Notably, there are disparities in the distribution of these diseases, with some conditions exhibiting higher incident rates among certain ethnic and socioeconomic groups. Determinants of AMS diseases are multifaceted, involving complex interplay of genetic, environmental, and lifestyle factors. Genetics can predispose individuals to these conditions, while environmental factors such as exposure to certain substances or infectious agents may contribute to their development. Lifestyle choices, including diet and physical activity, also play a crucial role in influencing the risk and progression of AMS. The economic burden of AMS is substantial, encompassing direct healthcare costs as well as indirect costs related to the disability, loss of productivity, and diminished quality of life. Estimating the annual cost of arthritis, musculoskeletal, and skin diseases in the United States involves considering various factors like I had just mentioned, including those indirect and direct costs. Keep in mind that these figures can vary depending on the data source and methodology used, but if we're looking at that first bullet point, arthritis, according to the CDC, the Centers for Disease Control and Prevention, the total annual cost is about $303.5 billion in the United States in 2013. If we're looking at that second bullet point, musculoskeletal, and a study published in the Journal of Bone and Joint Surgery, they estimated the annual cost of musculoskeletal diseases in the United States to be over $200 billion in 2014. And then skin diseases is an economic burden, but when I was researching, I couldn't find a specific annual cost, so just keep in mind that these may vary as well. Fibromyalgia is a complex and often misunderstood disorder characterized by a wide spread of musculoskeletal pain, fatigue, and tenderness in specific areas of the body, known as tender points. Diagnosis of fibromyalgia is challenging as there is no definitive laboratory test or imaging study to confirm its presence. Instead, healthcare professionals really rely on a comprehensive evaluation of symptoms, including the presence of widespread pain for at least 3 months and the identification of specific tender points. Common signs and symptoms encompass not only chronic pain but also cognitive difficulties, sleep disturbances, and heightened sensitivity to stimuli. While the exact causes of fibromyalgia remains elusive, factors such as genetics, infection, and physical and emotional trauma are believed to contribute to this development. Conventional treatments for fibromyalgia aim to manage symptoms and improve overall quality of life. Medications include anti-inflammatory drugs or antidepressants are often prescribed to alleviate pain, reduce inflammation, and address sleep disturbance. Additionally, lifestyle modifications such as regular exercise, stress management, and adequate sleep play a crucial role in symptom management. Fibromyalgia epidemiology is a complex and distinctive profile. In terms of the distribution, prevalence rates indicate that approximately 2 to 8% of the global population is affected. Women are more popular to get it compared to men, and the condition spans across all age groups. It is more common in individuals between 30 and 60 years old, but can again be over all ages. On the average, an individual could pay around 100 to 1,000 per month, and the estimated cost for fibromyalgia in the U.S. right now is around 12 to 14 billion each year. Not only with all the money lost, they are also dealing with severe complications that also require money spent, like the lower quality of life, more hospitalizations, major depression, death rates due to suicide and injuries, and other conditions. So just keep that all in mind in terms of the epidemiology and fibromyalgia. Looking more at the individuals at risk, certain studies suggest it's a higher prevalence among individuals with lower socioeconomic status, emphasizing the importance of considering social determinants and understanding the burden of the disease. There are also cases that show if you have arthritis or lupus, you are more likely to develop fibromyalgia. Additionally, there may be disparities in diagnosis and access to healthcare services among different demographic groups, contributing to variations in the reported prevalence. There are other characteristics that have been linked as well. These risks include women, traumatic events, repetitive injuries, illness, family history, and obesity. So keep that all in mind as well if you know somebody or if this is you. Sadly, those individuals are a little bit more at risk. In understanding pathophysiology of fibromyalgia, we delve into the intricate mechanisms that contribute to its complex nature. Central to this is the concept of central sensation, where the central nervous system becomes hypersensitive to pain signals. In fibromyalgia, this is heightened sensitivity is linked to disruptions in neurotransmitters, chemical messengers in the brain, so such as like serotonin or dopamine, which all play pivotal roles in regulating pain and mood. Later, we'll dive a little bit deeper into supplements that have been researched to help fibromyalgia, such as magnesium and melatonin. As I mentioned in the last slide, magnesium can alleviate some of the fibromyalgia symptoms. So what magnesium is an essential mineral with roles in muscle and nerve function, energy production, and bone health. But beyond its historical use for easing muscle cramps and nerve function, it is now gaining attention in addressing fibromyalgia. So this condition involves, like I said, muscle pain and tenderness, and magnesium is being considered due to its influence on how our nerve and muscles work together. By potentially improving nerve and muscle function, magnesium might offer relief to individuals dealing with these challenges. When researching studies that show the effectiveness of magnesium on fibromyalgia patients, came across this first study, which was a randomized controlled double-blind trial. The study included 4 visits, which included an inclusion visit, randomization, and initiation of treatment, and at the an end of treatment visit and a follow-up visit. All patients had to be over the age of 18, diagnosed with fibromyalgia, as well as score over 18 on the depression, anxiety, stress scale for 42, which is considered the DASS 42 scale. They compared once a day oral magnesium 100 milligrams to placebo for 1 month. The primary endpoint was the level of stress on the DASS 42 scale, and secondary endpoints were pain, sleep, quality of life, fatigue, social vulnerability, and magnesium blood concentrations. Magnesium supplementation significantly reduced the mild-moderate stress group, whereas the placebo group did not significantly change. On the right, you could see one of the diagrams from the study showing the comparison between magnesium and placebo effects on an individual's stress scores, showing that magnesium did have a significant decrease compared to the placebo. Pain severity also decreased significantly, but none of the other factors decreased a lot. So the findings showed that magnesium improves mild to moderate stress and reduces the pain in fibromyalgia patients. There were some limitations of this study, included the sample size, duration of the treatment, and/or doses, but overall did show some positive results. In the second study I found, it was a 16-week randomized clinical trial to determine whether tryptophan and magnesium-enriched Mediterranean diet could improve psychological and sleep parameters in women ages ranging from 40 to 60 with fibromyalgia. They were asked to not make any lifestyle changes, and the intervention group was a Mediterranean diet with high doses of these tryptophan and magnesium, whereas the controlled group was told to follow a standardized Mediterranean diet. This diet included 350 milligrams of tryptophan and 375 milligrams of magnesium, and the experimental group also had to add 60 extra milligrams of both tryptophan and magnesium by eating walnuts at both breakfast and dinner, including 3 to 5 units. They were instructed to take a bunch of questionnaires before and after the intervention that asked them about sleep quality, body shape, anxiety, mood states, and eating attitudes. The study showed a significant difference in mean scores of trait anxiety, self-image, perception, mood disturbance, and eating disorders, showing positive results compared to the control group. On the other hand, sleep quality was not improved, as you can see the diagram on the right, the black bars being the control group and gray being the experimental group. The sleep quality was not improved by any means for the experimental group, but as you could see, the control group decreased significantly lower. This shows that although magnesium does not necessarily benefit sleep quality, it still does not affect it, which is a good sign. There were some little limitations, such as middle-aged women were more willing to try a diet compared to men, the sample size, and then tracking life stressors. These results also cannot guarantee the same results in other age groups, diseases, or conditions, and they mentioned tracking their exercise as they were on the honest system. The last study I found for magnesium in fibromyalgia patients, the study conducted a pilot study, Fatima study, that to see if coenzyme Q10, magnesium, and tryptophan in fibromyalgia patients was effective. It was a double-blind, placebo-controlled 2-period pilot study from March to October. Participants had 2 3-month treatments with NSC and placebo, with a 1-month washout period in between. The combined index of severity of fibromyalgia questionnaire was used on 23 female patients ranging from 18 to 80 years old who had been diagnosed with fibromyalgia for at least 2 years. 20 patients finished the study, and 65% of individuals had reported to be depressed, and 30 reported to have anxiety. Fatigue, functional capacity, pain, and sleep quality all improved at the end of the study, whereas they declined after the placebo treatment. As we could see in all 3 studies, there were positive results for patients taking magnesium when diagnosed with fibromyalgia. When reviewing the last 3 studies, it shows that overall there are positive results decreasing symptom severity in fibromyalgia patients by increasing the amount of magnesium a day in your diet. So I would recommend taking it by 100 milligrams a day pill, or by increasing amounts of food containing magnesium. Although there are some worries when incorporating this in your diet, such as limitations on studies, as well as each person has different reactions to these supplements. So keep that in mind, and I would suggest talking to a physician prior to beginning supplementations in your diet. As I mentioned before, melatonin also can help fibromyalgia patients. So melatonin is often dubbed as a sleeping hormone and is a natural substance produced by our brain in response to darkness, helping regulate our sleep-wake cycle. Known for its traditional use in improving sleep and addressing jet lag, melatonin is now being explored as a potential aid for those with fibromyalgia. This condition often comes with disrupted sleep patterns, and melatonin, by influencing how our central nervous system works during sleep, is thought to indirectly alleviate some of those symptoms associated with fibromyalgia. Now on to the second supplement I researched, which is melatonin. This first study was a systematic review pulled from databases to see the impact melatonin has on individuals diagnosed with fibromyalgia. Out of 224 screened studies, 4 studies were identified as eligible to be included in this review. Interventional studies were controlled or uncontrolled and randomized or non-randomized to see the effectiveness of melatonin on individuals with fibromyalgia. They tested to see the effect of melatonin on disease impact, pain, sleep quality, tender point count, fatigue, anxiety, stiffness, and depression on these individuals. The mean age of these patients ranged from 38.8 to 51, as well as these studies tested dosages ranging from 3 to 15 milligrams a day, and studies ranged from 10 to 60 days for the duration of the treatment. In one of the studies, they tested the difference between 3, 6, 9, 12, and 15 milligrams a day of melatonin taken 30 minutes before they went to sleep for 10 days. They assessed the sleep quality and found great results. The results showed that the intake of 6 and 12 milligrams a day reduced sleep latency and significantly improved sleep efficiency and mobility, actual sleep time, and the overall quality. While they all showed great improvements, the 12 milligram proved to have the most significant reduction. Although I went more in depth on one study, there were positive results in all the studies regarding the effect of melatonin on disease impact, sleep quality, pain level, and tender point count. The aim of this second study was to assess the effect of different doses of melatonin on quality of life, mood status, pain, anxiety, and urinary cortisol levels in patients ages ranging from 40 to 60 years old with fibromyalgia. Individuals took different doses of 3, 6, 9, 12, and 15 milligrams a day for 10 consecutive days, with placebo given during the 10 days either before or between melatonin doses. All patients took the same dose of quick-release paint-derived melatonin pills 30 minutes before going to bed, and during the washout periods they took pills containing rice starch at night. At the end of each 10-day period, they completed a battery of self-report questionnaires to evaluate symptoms. In general, melatonin improved mood, quality of life, and reduced anxiety levels in these patients. All of these doses had significant decrease in pain levels compared to the baseline. If you look at the diagram on the slide, you could see that the melatonin compared to the placebo group had a pretty big difference, showing a decrease in pain. Doses of 9, 12, and 15 milligram decreased the scores for the fibromyalgia impact questionnaire and urinary cortisol levels as well. Along with doses of 12 and 15 milligrams of melatonin had a significant decrease in state of anxiety based on the state trait anxiety test scores. Lastly, the 9 milligram dose improved the visual analog scale in short form 36 health survey. The higher doses did in fact show positive results in all aspects, some not as significant as others, but overall helped them all. Melatonin appeared to decrease important fibromyalgia-related symptoms such as low mood state, increased anxiety levels, high pain levels, and impaired quality of life. In this last study I found, it focused on the effects of melatonin treatment on disturbed sleep, fatigue, and pain symptoms observed in fibromyalgia patients. It included 21 female patients, with only 19 of them completing the study, with ages ranging from 21 to 68 years old. They were included in a 4-week pilot study after a 1-week washout period. Each patient took 3 milligram gelatin capsules of melatonin 30 minutes before expected sleeping time, just like the other studies. All patients were evaluated by the same physician immediately before and after treatment period. They also participated in surveys before, during, and after the study to compare the results. These studies included a visual analog scale, sleep disturbance, fatigue, depression, anxiety surveys, and patient-physician global assessments. At day 30, the tender point count, severity of pain, patient and physician global assessments, and the visual analog scale showed a significant of improvements. If you look at the graph, you can see the difference between the tender point count and the severity of pain from day 0 to 30 showing improvements. With that being said, 30 milligrams of melatonin a day for 30 days improved many of the symptoms significantly. Now, a limitation with the study was that there was not a control group to compare it to, but you could still see improvements based on day 0 to 30, which was really great. Overall, positive results were shown decreasing symptom severity of fibromyalgia patients taking doses of 3, 6, 9, 12, or 15 milligrams a day of melatonin 30 minutes before bed. Although the higher doses had significant reduction compared to the smaller amounts of consumption, but all showed improvements in some way, as I talked about in the past slides. Overall, they have similar methods to testing the efficacy of melatonin on fibromyalgia patients, showing a decrease in pain, anxiety, mood, urinary cortisol levels, and fatigue. Despite these positive aspects, there are concerns that arise regarding the generalization of findings due to the limited size of trials and the potential influence of other factors on sleep patterns. The safety profile of melatonin is generally considered favorable, but caution is advised, particularly in the context of individual variations in response and potential interactions with medications. I did come up with some recommendations based on my research of incorporating magnesium and melatonin in your day-to-day life as a fibromyalgia patient. When incorporating magnesium and melatonin into your routine, it's important to start with the lowest effective dose and monitor how your body responds, as each person responds differently. These supplements can complement each other, as magnesium may promote relaxation and melatonin can aid in sleep regulation. Ensure you choose high quality supplements as well. And if you are concerned about existing health conditions, consult with a healthcare provider before adding these supplements into your regimen. Remember, individual responses may vary, so pay attention to how your body reacts and make adjustments as needed. Additionally, maintaining a consistent sleep schedule, practicing good sleep hygiene, and addressing any underlying issues contributing to sleep disturbance are integral parts of holistic approach to better sleep and overall well-being. In terms of magnesium, you can incorporate this through food in your diet or taking 100 milligrams a day, as well as in melatonin. Doses of 3, 6, 9, 12, and 15 milligrams a day all have positive results. Ultimately, it's important that you talk to a healthcare provider before beginning these supplements, but both do prove to have impact on alleviating some symptoms in fibromyalgia patients. As you can see on that left side, there are some other supplements that are being researched as well for helping alleviate some symptoms. I did list some of their benefits, although I did not research in depth. These are pretty generalized, so just keep that in mind before taking them. On the right, you see the mind and body therapies. These can help with the psychological side and struggles that fibromyalgia patients deal with. I also listed some benefits, so if you are more interested, I would suggest researching more and keeping that open line of communication with your healthcare provider to see if that best fits for your symptoms.